Today, if you're a mum-to-be, you're special. To experts like your doctor, to your partner and family, and others who help. They help in this free guide to a healthy pregnancy. It tells you why it's so important that you see your doctor as soon as you think you're pregnant, and shows you the kind of food you should be eating. If you are a mum-to-be, there's a lot of help around you today. Everybody likes a happy ending.
During pregnancy, all parents hope for a healthy baby. And as we've just seen, health advisors encourage us to believe that by changing our ways, leading a pure life, not smoking or drinking, eating the right food, avoiding stress, and attending antenatal clinics, a healthy baby will be born. But can anyone, parent or doctor, influence the outcome? Medical care today leads people to expect perfection, even miracles. Doctors eager to help often overstate their ability. But the public are also guilty by encouraging scientists to believe that they can or ought to achieve perfection. Over the last few decades, there have been enormous advances. For instance, some mothers with a rhesus-negative blood group have babies who are rhesus-positive. This compatibility sometimes used to kill the baby. 15 years ago, when this film was made, the baby underwent an exchange blood transfusion, complicated and not always successful. Today, mothers who have babies with Rhesus disease have a simple injection and the problem is virtually eliminated.
Right. Brown, isn't it?
Rubella or German measles should be the next great success story.
I'll wipe it.
Women who catch this disease during the first months of pregnancy
Look.
face the possibility of giving birth to a deaf or severely disabled child.
That's right. That's it. Look inside.
With vaccination at school, the next generation of mothers should not find rubella a problem.
Clean.
But today there are other difficulties which have yet to be overcome. Babies are still admitted to special care units, and for a variety of reasons. One of the most common is prematurity. Babies are born too early, cope on their own, and sometimes too early to survive at all.
For the first pregnancy, I had a miscarriage at 24 weeks. Then I had two early miscarriages. Then I had the one where I got to 29 weeks, and the baby lived 11 days. And she was about £3.2, I think. And we had him. He was born between 26 and 27 weeks pregnancy, and he weighed 1 £12. He was in the incubator for 9 weeks, and then he was put to a cot. And we got him home just over 18 weeks after I was born. And he's been fine ever since, on the whole. Just from there, we seem to think, well, worth trying again for another baby.
We don't really know why a mother can be a pregnant mother in the morning. She can be a delivered mother with her baby breast the same afternoon. The biological alarm is a marvellous thing, and it does just seem that in some women it goes off too early. They are normal women, normal babies, they just ring the bell too soon.
Hello, Mrs. Brown. Come on in and have yourself a seat.
So this woman, who has one child, is now in her 6th pregnancy. Women like her, who repeatedly give birth to very premature babies, are the special interest of consultant Tom Lind at Newcastle. One approach to the problem could be to concentrate on the care given to the premature baby, but Tom Lind has other ideas.
I think a much better answer would be to keep them in the womb, the perfect incubator, for longer, till they're born at a normal time. That's our particular research is at the moment.
And this thing's not giving you any trouble?
No, it's been a good one.
Indeed, it's been a good one. You have had trouble in the past, haven't we?
We are quite crudely using drugs, I think sophisticatedly, but really quite crudely using drugs to dumb down the action of the uterus. Normally, our screening technique at the moment is only take those women in who all other methods have failed. So they have awful history behind them. We're talking about ladies that have had 5 or 6 pregnancies and no living children, in whom drugs at the time of labour, suture on the neck of the womb, bed rest, drugs by mouth, etc. have all been tried and have not been successful.
Well, yes, it is a little bit awkward.
So this is one example of how doctors can prevent handicap in babies. But how do they go about detecting abnormalities? The two most common are spina bifida, or neural tube defect, and Down syndrome or Mongolism.
I just want this to go in nice and easy.
The starting point is usually a test on the mother's blood,
Okay.
a relatively straightforward one to measure the alpha-fetoprotein level, AFP for short. Most women are given this test just as a routine, often without their knowing it. But the test does not of itself diagnose that the baby is abnormal. It will merely suggest that the woman is at risk or not. Should the test be positive, further tests then have to be made to diagnose whether the baby is affected.
Okay, well,
The most widely used diagnostic test is probably sonar scanning or ultrasound.
That's the baby's head, which we can see beautifully.
The scan gives a TV picture of the baby in the womb, and as the bone structure shows up so well, it can detect abnormalities of the spine associated with spina bifida.
That's a beautiful spine. That really is a beautiful spine. I mean, really, this...
And it's in the detection of spina bifida that sonar scanning with the best equipment is most effective.
moves its lower limbs, of course, that's also very useful in terms of knowing that it isn't paralysed and this sort of thing.
But in detecting the other abnormality, Down syndrome, another much more intrusive test has to be used, amniocentesis.
Just going to put this needle in, just to fill this needle.
You put a needle through the stomach into the womb to take some of the water, the amniotic fluid, from the baby, and do the same test on that fluid as was done on the blood. This is a much more sophisticated, more accurate test. From the same fluid, we can take cells from a living baby to look at its chromosomes and detect Down syndrome. But there's a price to pay. Amniocentesis is an invasive and risky procedure. Therefore, we cannot offer the screening technique to everybody because amniocentesis would be too dangerous.
It is arguable, but some people would say that you could miscarry following that test with a risk of about 2 miscarriages per 100 tests. Now, if you're looking for a problem which only occurs 1 in 400, then if you screened 400 women, you would have had miscarriages in 8 women of normal babies to have saved, in inverted commas, by offering termination to those that either have a neural tube defect or mongolism. So it is this very careful balance that one must bear in mind when counselling patients, and that patients perhaps must not be too strident in their demands for diagnostic tests until they have fully appreciated the problems of those tests.
But women will never be able to appreciate the problems until we as doctors treat them as responsible people, capable of understanding what is involved and assessing the risks. Should we not be helping women to make a decision rather than making it for them?
With great respect to most women, I think that some people get a hold of a very tiny proportion of knowledge and believe they know it all. And I think that just isn't true. I think discussions about amniocentesis cannot be left to the patient, for example, unless they're almost as clever as I am, and there aren't too many of those around.
Well, it's not just a question of being clever, is it? It's a question of having good information. And don't you think that given modern methods of communication that people can acquire as much knowledge as you and I?
No. I don't think you can intellectualise whether a woman should have a forceps delivery or a cesarean section or an epidural beyond a point. And that is that you'll give them the information, and in my view, most will then say, thank you, what do you advise? And that's got to stand up and be counted.
You can also say, well, it's up to you.
Ah, but it isn't. It's up to me.
I think I must have been about
But that's an
11.
attitude I cannot accept. I think the parents ought to be encouraged to decide for themselves.
How did you deal with that?
Sue and Paul Johnson consulted Tom Lind when they realised that Sue was a carrier of the creeping disease muscular dystrophy, which only affects males. But they wanted a family. Amniocentesis will determine the sex of an unborn child. But should the fetus be male, and should they decide to abort it on the grounds that it could suffer, they could be aborting a healthy boy, for only 50% of males actually suffer from the disease. A terrible dilemma.
Personally, we couldn't cope with the fact of knowingly bringing a boy into the world that had muscular dystrophy.
What was the worst thing about the time of the testing, so far as you two were concerned?
The waiting.
The waiting.
Yeah.
How long was that wait before you had the news?
For 16 weeks, when I had 16 weeks pregnant, when I had the amniocentesis, and then it was 3 weeks after.
3 weeks later.
Yeah.
And news obviously was good because Kate,
Fabulous. Yeah.
beautiful little girl.
Yeah.
I looked after a lady who was in exactly the same position as you, where her brother died of muscular dystrophy at about the age of 60, and knew about the situation and resolved at that time that if she had a boy, she can go through with the pregnancy. So she asked amniocentesis and did it. And unfortunately, I had to give her the news when we got the result that it was a boy. And the incredible thing to me was that at that time, she said, well, Even what I said before was I'd have the pregnancy terminated. I now can't do it. And she chose to go on with the pregnancy. How do you react to that decision, considering your own?
I think she's extremely brave.
Yes.
If she can cope with that, and that's her decision, she's extremely brave. Personally, I don't think we know which side couldn't.
So you recognise the choice is an individual one?
Yes,
Very much personal and individual choice.
But choice implies responsibility. What can we as parents do to improve the health of our unborn children? Some women find that simply being pregnant gives them the incentive to stop doing those things that are bad for anybody, pregnant or not. They drink less, stop smoking, and take more care over medicines. But some women find this quite difficult. And does it help smokers, for instance, when the case against smoking is overstated?
This is what can happen if you smoke when you're pregnant. You may deprive your baby of oxygen. You may poison its bloodstream with nicotine. Smoking can make your baby premature, undernourished, with thin arms and wasted flesh. It can make him vulnerable to illness for months. It may even threaten his life. Is it fair to your baby to smoke cigarettes?
I'm worried about this approach, not merely because I don't think that it works, but because I have yet to see any evidence which supports those extravagant claims. And without this evidence, I'm in a difficult position when I meet pregnant women who do smoke.
Janet, one thing I've never brought up with you is that I notice on your chart you smoke 15 to 20 cigarettes a day. Is that right?
Yes.
What about this question that it has an effect on baby's weight? Do you know about that?
Yes, I had heard that.
Yes. Matthew was £6.12 when he was born. You didn't smoke at all in that
No.
pregnancy?
Not after the first
No.
month.
Do you feel that you're bigger or smaller this time? Or?
Smaller.
You feel you're smaller?
My own body
Yes.
weight hasn't gone up as much.
But you're not worried about your own weight gain?
No.
No. Are there any things that I could say to you or anybody else could say to you that would make you stop smoking or want to stop smoking?
Well, I've known people that have smoked during pregnancy and their children have been perfectly normal.
Mm-hmm.
And I don't feel any different in myself this time. I'm pregnant and I've kept smoking all the time, whereas last time I did stop. And quite honestly, I felt worse than I have done this time.
Yeah. Do you know that it's often said that up to 1,000 babies die each year in this country because their mothers smoked? Does that shake you, that statement?
Yes. I mean, how do they know that 1,000 babies a year do die through their mothers smoking?
Yeah, well,
Are
I
they
think that's
pregnant?
a very good question.
Yes.
I mean, do you think that your baby knows when you smoke a cigarette?
No. It doesn't. I can't feel it doing anything different
Right.
when I smoke.
But if there was some means of showing this baby's reaction when you smoke a cigarette and you saw an effect, would that worry you?
Not unless it was shown that it was harmful.
A harmful effect. Well, shall we go and see?
I doubt whether I can prove that there is any harm to her baby when she smokes. But I may be able to find out whether the baby knows when its mother is smoking by seeing whether there is any change in the baby's heartbeat before and after a cigarette is smoked. Janet Harris, as we know, smokes between 15 and 20 cigarettes a day. Sally White doesn't smoke at all. In this experiment, I'm monitoring their baby's heartbeats on the cardiotocograph.
Well, Janet, if I compare the trace of yourself with Sally, the pattern overall looks very much the same. The rate's about the same, the variation in the speed of the two hearts is about the same. Let's see what happens when you light a cigarette. Looking at the trace, the heart rate's not changed very much, but the lower indicator has jumped a few times, which suggests that the baby's woken up. These little movements here are the baby kicking. The heart rate pattern is really very little different. The baby, Janet, will respond to anything around it that it can sense, and it responds by its heart rate changing in its rate.
So what I want to do is to make a loud noise beside you and see whether the baby hears it in the sense that its heart rate reacts. Do you mind if I do that? I don't know whether the baby can hear what I've just said, but just handcuff you a wee bit. Okay? It didn't like it. Its heart rate's actually dropped. It's very interesting when we look at Sally's trace. Sally's baby behaved in exactly the same way as Janet's. If anything, a little more strongly. The heart almost dropped a beat and went right down to 100 just for a very few seconds and then returned to normal. But just because that experiment failed to prove that smoking can harm the baby, it doesn't mean that there are no risks involved in smoking in pregnancy. And it's up to parents and doctors to assess those risks and for mothers to decide what to do. But what are the risks? What should I tell women who I know are pregnant and who smoke? I put this to Robert Hume, a consultant paediatrician in Edinburgh.
I think this is a very difficult issue. It's very difficult to give up smoking. But we do know that babies born to mothers who smoke during pregnancy are in fact lighter, are smaller than the norm.
How much lighter are we talking?
We're talking about 200, 300, 400 grams lighter.
What, that's a quarter to half a pound?
Yes.
Some women might say that was a good thing. They didn't want a great big baby.
They might well say that, but we have a certain amount of other evidence to suggest that in fact the development of those babies may be slower and that may be subtle neurological problems detected in later life.
So the truth is that otherwise, apart from the effect on weight, we don't know that it's harmful, but on the other hand, we certainly don't know that it's harmless.
I think you've summarised it very well.
But there are some women who confessedly are addicts and say they can't give it up and find some benefit in the way they feel in their busy, stressful lives from smoking a cigarette. Do you say you must stop?
I think we can only advise.
Right. Janet, this is the first time you've seen it, haven't you? Because it was in front of you all the time. And of course, we mustn't be surprised if our advice is ignored. There's that rise in the baby's heart rate when you first started smoking. And the baby seemed to kick a bit there. And then this is where I made the loud noise, and that's the drop in the baby's heart rate.
Mm.
Does that tell you anything?
Not really. It doesn't seem to have changed that much, but I won't know.
Are you going to have another cigarette?
Yes.
Well, there we are. Interesting. Despite having understood the propaganda against smoking, Janet Harris chooses to reject it. Her disbelief is founded on her own experience, but at least she had the information. I'm far more worried about other areas of concern in childbearing where women have no information.
Few pregnant women think twice today about getting an ultrasound scan. Even Lady Diana had one and found she's going to have a boy. Ultrasound is a type of radiation, but unlike X-rays, ultrasound is called non-ionizing. That's what makes doctors almost universally believe it's absolutely safe. That unlike X-rays, it causes no damage to the fetus.
I do not tell my patients that there's a potential harm because I do not feel there is evidence that there is a potential harm.
But a CNN investigation reveals growing evidence that
strippers. Sunday controversy at 1:25 Donahue.
But now for his thoughts of the day.
If you think I'm a wicked lady, if you're tempted by my evil charm,